Morning, ladies and gentlemen. Welcome to the Theatre Royal Dumfries. I'm Mark Alexander, the Theatre Director, and I'm going to say we're very happy to have OutPost Arts Symposium on Wellbeing. I'll hand you over to Lucy Bell.
Sorry, I should come closer to the microphone. Thank you very much, guys, and welcome. I think we are going to dim the lights slightly in a moment so you can see the slides slightly better, so just bear with us until we have a chance to do that. But it is my honour to welcome you all. We're delighted to host you here in the fabulous surroundings of the Theatre Royal Dumfries. And we warmly welcome you to this, the inaugural D&G Creative Health and Wellbeing Symposium. Excuse me. We're delighted so many of you could make it along today. We're thrilled to welcome attendees and speakers from a diverse range of backgrounds and sectors, brought together by an interest in strengthening connections between art, culture, and creativity, and health and well-being. We've put together an interesting, what we hope is an interesting and stimulating agenda, and we hope that everyone goes away today with something truly valuable. Just a wee bit of housekeeping before we get started. So John has mentioned a film that's happening for the Regional Cultural Fund. We're also documenting the day with a photographer. I was going to just ask Kirsten to make herself known in the corner at the back there. She's waving. Thank you, Kirsten. And Rory as well. Again, if you would prefer not to be filmed, if you just make them aware, that would be fantastic. Thank you. Should you need help today with anything or any support, or if you have any questions, you can identify our volunteer support team by their yellow lanyards, very snazzy. Our volunteers are a mix of adult community programme graduates and OutPost Arts trustees. And in Susie's case, which I believe she's here, she is both. We are incredibly grateful for their presence today. We very much encourage you to take your own photographs and reels, makes me sound very young. And if you share them on social media, please feel free to use the hashtags. Now, this is where the clicker comes in. Bear with us. We're all getting used to the clicker. There's a magic direction, I believe, of the clicker, which is over there somewhere. And these are our hashtags. Hashtag DG Creative Wellbeing and hashtag DGCW Symposium. And that means we can enjoy your photographs as well. You can access the symposium agenda and speaker profiles via the QR code on your name badge. That's what that wee thing at the bottom is. Very snazzy, isn't it? And it's also printed on the paper agenda tucked into your manifesto. If you don't already have a manifesto, it looks like this. You should have seen it on your way in. If you don't already have one, you can collect one from the atrium area during the break. Now, on with the day. So we're going to start with a series of opening remarks, and I'm thrilled to kick things off with the official launch of the Manifesto for Creative Wellbeing in Dumfries and Galloway. Yay! The Manifesto is the result of the DG Creative Wellbeing Project, an ambitious and far-reaching 2-year project spearheaded by OutPost Arts and delivered in partnership with a pool of incredibly talented associate artists, some of which are here today, with other regional arts organisations who foster similar ambitions and goals, with third sector organisations interested in adding creative services and support to their models of care, and finally with NHS D&G, who have championed the project and helped nurture its development with care, commitment and consideration. So just briefly, some context about DG Creative Wellbeing. Temperamental. Hey, that way. From 2022 to 24, supported by an alliance of funders, OutPost Arts gathered a team to coordinate regional programmes of artistic and cultural activities, interventions and actions that focused on improving the well-being of people and communities, people in communities and healthcare environments, and enhancing clinical spaces. DG Creative Wellbeing Project brings together 3 distinct pillars: community, network, and healthcare, forming a holistic model which maximises impact and reach. Unifying the project under an umbrella project title simplifies the project's message, allowing the work to be shared and understood more easily. So there's a magic person in the audience that I think if I... So here are some of the project's objectives, which you'll hear more about, alongside details from the various programmes and initiatives delivered as part of the DG Creative Wellbeing Project later this morning, when we welcome the amazing coordination team onto the stage, and they will talk us through the impactful work. What I can share with you right now, though, is the really exciting news that we've received awards from the National Lottery, the Hollywood Trust, and Dumfries and Galloway Health Board Endowment Fund to enable us to develop the DG Creative Wellbeing Project further over the next 3 years, from March 2025 onwards. And I'm just going to go, yay! Woohoo! Thank you. Much appreciated. But now, back to the manifesto. DG Creative Wellbeing Project has had hugely meaningful impacts on the well-being and lives of participants and those who care for them. In many cases, lives have been transformed. The manifesto pulls together the learning and the evaluation from the delivery of this work and distills it into 6 key themes. By using accessible language and engaging visuals to communicate these themes and the messages that have informed them, we hope that the manifesto can be used as an evidence-based foundation for future action and creativity, helping guide and anchor new creative health and well-being focused initiatives and strategies. We also intend on expressing the manifesto using creative means. We are an artistic organisation after all. Encouraging stakeholders to engage with and form their own connections to its themes through artistic expression. We will explore commissioning work and working with partners to interpret the manifesto using a variety of art forms and share creative outcomes through various platforms and channels. The manifesto underpins today's agenda, guiding the discussions during this afternoon's breakout sessions that I hope most of you will be here for. To introduce you to the document, I'll just very quickly summarise its themes, inviting you to read the entire publication at your leisure. We'll carry out post-event evaluation that will allow you to give feedback on the manifesto's content at a later date. Yay! So the first theme is We Are All Artists. And this theme highlights that everybody is born creative, and through art and play, children learn important skills, build confidence, it aids comprehension, and supports us to be happy. As John Lennon pointed out, every child is an artist until he's told he's not an artist. Although the he dates that statement, I think the sentiment is utterly timeless. Number 2, creativity is a vehicle for change. This theme highlights that being creative helps us cope with emotions, lets us connect with others, it builds resilience, helps us to manage our mental health, allows people to relax and to express themselves. It can also positively impact on others when we share our artistic creations. Number 3, creative well-being is about the journey and not the destination. This theme highlights that the creative well-being approach helps people enjoy the creative process without fearing failure, building confidence and resilience through support and shared experiences, embracing creative challenges and encouraging experimentation, which leads to personal growth. Creative well-being is for everyone. This theme highlights that the creative well-being approach removes barriers like fear and poverty, a million barriers that we could face. It makes creativity accessible, but it's important that we understand those barriers in order to provide creative opportunities suited to people's needs. Creative Wellbeing is about living well. This theme highlights that health isn't just about medicine and clinical treatment. It includes things like community, lifestyle, support. Art is proven to improve mental and physical health. It helps with child development and the management of illness, amongst many, many other things. And lastly, this one doesn't want to be revealed. The creative wellbeing approach requires investigation, understanding, and long-term investment. I see all the arts organisations going, yes! Creative health and wellbeing programs improve mental health, reduce isolation, support people to live well, but they face challenges. Rural regions face particular challenges. Stronger policies and strategies are required to support creative health and wellbeing initiatives to become embedded and safeguarded. It's now my pleasure to welcome Valerie White, the Director of Public Health for NHS D&G, to make her opening remarks.
Thank you so much, Lucy. It's really, truly a pleasure to be here today. I'll hopefully get to grips with the clicker as well, Lucy. I read many reports. There we go. I read many reports, and I have to say that none brought me as much joy as reading the Creative Wellbeing Manifesto, so I commend it highly to you all today. So, as Lucy said, I'm Valerie White. I'm the Director of Public Health at NHS Dumfries and Galloway. I'm also the Executive Lead for our Arts and Healthcare programme. So, Director of Public Health, that seems quite a big fancy title, doesn't it? Well, what does it actually mean in practice? Well, I work as one of the senior executives at NHS Dumfries and Galloway, supporting our Chief Executive, Julie White, my other Executive Director colleagues and our NHS board to deliver healthcare services for our local population. But this is our mission as an NHS board, and I hope you can see that it's actually much more than just delivery of health services. It's how we work with our partners to help and support people to keep well. I have quite a specific focus on improving population health and also protecting population health, and it's quite a wide and varied role, and the particular aspect of it is about supporting individuals who may experience more adverse outcomes to health as well. So the role is pretty varied. I think during the COVID pandemic, it was very much focused in that protection aspect of health. But we also run a range of programmes that aim to keep people healthy. Our immunisation programmes, we deliver 14 immunisation programmes, 250,000 vaccinations each year to keep people healthy right from cradle to grave. We also run a number of our screening programmes which help to detect disease at an early stage and support people for treatment too. We also run a range of programmes to support people to stay wealthy from our Quit Your Way services, our breastfeeding support and awareness, services to our healthy weight, services for children which support children to be of a healthy weight. But also what we're really wanting also to move into that space of is about community connections to the supports that also keep people well. And this work that we've been doing with OutPost Arts is a really key aspect of that. So improving the health of our population, I don't think has ever been more important, because as we've emerged from the pandemic, the challenges that we face nationally in Scotland, but also locally in Dumfries and Galloway, are really quite significant. The number of years that people live in good health is reducing. People are living more years in poorer health. And what's very worrying is that the gap between those who are wealthiest and those who are poorest is increasing. And so what makes us healthy, what keeps us well, actually is not just about the health services. You'll see here on this slide what we call the kind of building blocks of health, sometimes called the social determinants of health. And while healthcare is a really, really important aspect of it, it is actually much, much broader than that. And as I'm sure we'll hear today, the arts contributes to every single building block to keep us healthy. So when we have such real great challenges, when we need to tackle those building blocks of health, we have to do that in partnership. And there's a lot of talk, and I'm sure you'll hear about it more today, about a whole system approach. And that really is about everybody working together to really try and improve those building blocks of health. And in Dumfries and Galloway, we're very lucky to have really strong partnerships through our community planning partners, and that's where health, the NHS, local authority, police, fire, Scotland, there's so many partners, it's always difficult to remember, our higher education services. I said I wouldn't say so many M's, Marsley, didn't I, today? But our third sector and our communities are really fundamental key partners in looking at how we actually tackle some of these issues. And I know Katharine today is going to talk a little bit about the cultural partnership, which has just come into our community planning partnership arrangements, which I'm also involved in as well. We will get there with it, Lucy. I'll try. There we go. Oh, I went too far that time. So it really is such a privilege to be here today. There's so much more recognition of the role of the arts in improving health. And in 2019, the WHO undertook a review of the evidence, and I'm sure everybody in this room knows what the outcome of that was, that absolutely the arts have a role in improving health and well-being. Of course, as many reviews do, it calls for more robust evidence and further exploration, but it put it firmly on the health and wellbeing map. And this was further highlighted in their 2022 report, which looked at prevention and management of long-term conditions, and absolutely again re-emphasised the important role that the arts can play. The collaboration that there has been now through the Jameel Arts Health Lab is really with the WHO has really led to that development of the Healing Arts Scotland movement, and I know Nancy's going to talk later on about some of the national policy developments in that area. But really the Jameel Arts Health Lab is looking at how we can increase the evidence, build the capacity and advocate for the arts more in healthcare. And that led to the Healing Arts Scotland programme of work, which in Dumfries and Galloway we were delighted to be part of in August. But I have to say, when I read the Healing Arts Impact Report, it did seem to say that there's more work that could be done in this area in Dumfries and Galloway, and I thought, goodness me, we have so much going on in Dumfries and Galloway. We need to put ourselves much more firmly on that map, because we have such an amazing diversity of artists, culture, outdoor space. We really need to be shouting about some of the things we are doing in Dumfries and Galloway, because we absolutely deserve to be on that map. And the Creative Health Review, which was undertaken by the cross-parliamentary group with the National Creative Wellbeing Centre, which again I know Nancy is going to touch on, really again called for that advocacy about a cross-systems approach, reaffirmed that the arts is an important part of a healthy and prosperous society. It should be a fundamental part of a 21st century health and social care system, and really advocating the importance of accessibility for all and being able to help tackle those unequal outcomes in health. So I'm just going to go on and talk about our journey in NHS Dumfries and Galloway. Oh, yep. Well, I hope so. So, Lucy's going to talk in much more detail about the project. I'm just going to give an overview of a bit of our journey and where we are. And I think we've got a really strong history in Dumfries and Galloway in terms of the arts and healthcare. The Crichton Estate, which was the mental health facility established by Elizabeth Crichton, really looked at how the arts, poetry, drama, the outdoor space really added to the therapeutic value of the individuals that were treated there. If we fast forward on, we have our mid-park facility in Dumfries and Galloway, and I think this was opened in 2012, and I think that was really kind of the first of the next generation of healthcare buildings that really looked to marry about how a therapeutic environment can actually help in terms of recovery. When you look at buildings that were any earlier than that, they're very functional, they're very clinical, they don't really have that blend of architecture and clinical collaboration, which Mid-Park Hospital has. We then have the new Dumfries and Galloway Royal Infirmary, and for any of you who hasn't been to it, it is a beautiful healthcare facility. I think we should be really, really proud to have that in our region. And there was a very passionate group of individuals who came together to develop an art strategy to see how we could really integrate art, the outside, into the design of that building. And there's actually a case study on Architecture and Design Scotland about how that all came together. That spurred on a group of individuals to actually, how can we make the most of this? How can we take our arts and healthcare journey even further? And in 2022, there was a successful application led by OutPost Art to our endowment fund for a 2-year programme of arts and healthcare. And it really was as part of, as Lucy has said, that umbrella of DG, Creative Health and Wellbeing. Now, I can't lie, I think it was extremely challenging for OutPost to take forward the programme. We were just in 2022, we were emerging from the pandemic. We had a lot of management changes. We are a system that likes structures, processes, procedures. We can be quite risk averse as a system as well. So actually navigating that was really, really challenging, but navigated OutPost did. And what they have created is really been truly amazing. That real collaboration and interlink between the community aspects of the programme and the healthcare aspects of the programme have all nurtured each other beautifully. So I only became involved in the Arts and Healthcare Steering Group in 2024. So I spent quite a bit of time last year attending some of the launch events, speaking to some of the participants, reading the impact reports that had been produced, and really quite simply they were some of the highlights of my year. And you can see by the smiles on the faces of our staff and participants in the programme how much it has impacted on them. So we're moving to a new chapter now. We were successful in receiving 3 years funding for our arts and healthcare programme, again as part of that creative wellbeing agenda. And we're looking at that next chapter of where we want to go in terms of our vision and also aspects of our key priorities. And so I think it will be absolutely fantastic to make connections, to hear input from everybody around the room about actually where could this go, where could this take us for this project, because I think we have got a fantastic opportunity in Dumfries and Galloway to maximise all that is going on within our communities and really embed the arts as a way to improve population health. So that is, I think, me. So I'm so looking forward to today, so delighted to be here. Thank you.
Thank you very much, Valerie. That's fantastic. I'm going to give this a shot now, see if we can get it onto the next slide. Yay! So I just want to welcome next for the next opening remark from Professor Marion Bain, Interim Deputy Chief Medical Officer for the Scottish Government. Welcome, Marion.
Thank you. Good morning, everyone. And thank you, Lucy and Valerie, for those really, really inspiring insights already today about what's been happening with the Creative Wellbeing Initiative. As Lucy said, I'm Deputy Chief Medical Officer for Scotland, so I work with the Scottish Government based in Edinburgh. And I just wanted to say to begin with that this topic is one that I know the Chief Medical Officer for Scotland, Sir Gregor Smith, is particularly passionate about. And I, as his deputy, also am hugely supportive of it. So I'm really delighted to be here with you this morning. In the Chief Medical Officer's annual report last year, he set out really clearly how we need to understand how we can better connect and support people in our communities, especially those who are suffering from long-term health conditions, and along with that, the social isolation and often sense of loneliness that can bring. And we also know that missingness in healthcare, so that's where people don't manage to access care that would benefit from them, is a real issue. And so we do need to think differently about how we reach out to those who find it difficult to navigate the more traditional models of care. So thinking about care as a concept, it's clear that needs to go far beyond the narrow boundaries of healthcare alone. Our overall aim needs to be enrichment of life if we're to genuinely improve health and well-being. So it's a holistic response, it's a social response, it's a cultural response, and importantly, it recognises individuality and serves to enhance the experience of life from the position and perspective of the individual. Now, of course, there's not one solution for how to do this, but through movements like this, like what you're doing here, it is clear that we can build momentum within communities to extend support and those opportunities, those critical opportunities for connection. So, bringing people together for a common purpose, supporting mindfulness, encouraging creativity, reimagining work and care spaces centred around artwork, all the sorts of things that you're doing help people in our communities to have better health, and also help people, patients and healthcare staff to have a sense of shared value and ownership of services. So your Creative Wellbeing Initiative successfully brings together the worlds of the arts and health with a clear aim to improve health and the quality and experience of care. It's connecting with people through creativity, and it most definitely re-energises us to think differently about our way of working and our way of life. It actually represents the essence of realistic medicine. The realistic medicine is an approach which the Chief Medical Officer has been leading over several years. What realistic medicine is centred around is value-based, kind and careful care. And the work that's being done here is totally in tune with that. So I would say well done to everyone who's been involved to date, and I really look forward to seeing what you'll continue to do.
Thank you very much, Professor Bain. Really important remarks, and I'm just brilliant. And thank you for spending time with us today. Much appreciated. I'd just like to welcome for the last set of opening remarks from Katharine Wheeler, the Chair of the Cultural Partnership for Dumfries and Galloway. Welcome, Katharine.
Thank you. Hello everyone. I'm sure you're wondering what is the Cultural Partnership for Dumfries and Galloway, therefore who's the chair. But we've only just very recently established, so hopefully I'll be able to share a little bit about that today and our hopes and ambitions for how that will grow as a really valuable resource for the region. I'll have my fun with the clicker. Oh, I did it. Oh. You just carry on. It's okay, they're doing it, Lucy. So thank you for having me and giving me the opportunity to talk. It's wonderful to hear from everybody else who's here today. So firstly, just a little bit of background. For those who might not be aware, Dumfries and Galloway published its cultural strategy, and we have copies of that here today. There's some down here. And Melanie Farrow, who's our Dumfries and Galloway's new museums and arts officer, is here with some as well. So we published our strategy in 2022 after region-wide engagement working with arts, culture and heritage about what that should look like. We're quite a long way away from 2022, but most strikingly what came to the fore in that strategy was how much our region already has to offer, and the programs across arts, culture and heritage, and what DG Creative Wellbeing are doing is an fantastic example of the partnerships, what can be achieved within partnership work within that. Culture is not just the buildings that we go to, the stuff that we consume, the stuff that others create. It's also the ways that we express ourselves, the ways we connect with others. It's the way we celebrate our identity. It could be a favorite walk, a bench that we sit on. It could be an art journal program that we take part in. And I think that it's really important that we keep getting that message across. It's not just for some people, it's actually for everyone, and everybody should have access to it. And what we have in Dumfries and Galloway, I think, is enviable in terms of our understanding of that and our diversity, but it's also precarious. And it's something that we really need to shout more about. We heard about Valerie saying about the Haas report, and we need to make sure we get the support that it deserves. So, oh no, I've done it again. You know what? I'm going the wrong way. Am I pressing it the wrong way?
There just frantically.
Which one do we press? Is it this one?
It's the one on the right.
It's because I'm pressing the bottom one. I'm sorry. Okay. So the culture strategy lays out 3 core ambitions to achieve this, and those ambitions are our people, the practitioners, workers, volunteers that make culture happen. We're known for our approach to access and community-led culture here in D&G, where everyone can be a part of that. Our places, which is our natural environment, our cultural spaces, our living heritage that we have here in the region, and also the difference that we make. So the vital role that culture plays in our lives, and that's across sectors. Okay, let's try and press the right button. Yay! And then it referenced 3 enablers. So how are we going to do this for our region? So one was in capacity. We need to invest in our creative workforce, our projects, our programs, and grow our regional sort of infrastructure towards that rich, diverse ecology for future generations. Connectivity. How do we stay connected within arts, culture, and heritage? There's some great connections, but there's also, out of necessity, people working and feeling quite isolated. How do we connect to areas such as health? So that's something. How are we working collaboratively towards shared goals? And then there's communication. So sharing information with each other, with others, telling the story of our arts, culture, and heritage in its widest possible sense, together with communities, and how it's making impact across our lives, making that more visible. So the establishment of the cultural partnership was one of the recommendations in the strategy for how that might be achieved. It was proposed as a way to connect creativity, culture, and heritage, to work together with individuals, groups, businesses, as a contributor to our economy, to our quality of life, and as D&G as a leader for culture in Scotland. The partnership was formally established in December, just past, and it's got founding members of Dumfries and Galloway Council through Melanie Farrow, who's here today, South of Scotland Enterprise through Mark Geddes, who's our head of creative industries, Museums and Heritage Network through Judith Hewitt, and DG Unlimited through Tabby. How do I pronounce Tabby's name? Medallia. Tabitha Medallia. I was appointed as independent chair, and we are in the process of recruiting a coordinator and an administrator. So the role of the partnership is really to champion and support our region's cultural work in all its forms. It's a space that we can join up strategies and identify gaps and areas that there may be duplication, that we're not working so well together, and what the needs of the sector are. But most importantly, it should be representative of the sector, not just those founding partners. So the next stage is to expand the partnership through the creation of subgroups. We're calling them thematic groups that would cover priority areas that have been identified through engagement work so far. So fair work, visitor economy, health, place and community wealth building, and skills and education. So what we're doing right now is to appoint interim chairs for those groups to start to bring people together around those topics. Our interim chair for health and wellbeing is Lucy from GG Creative Wellbeing, which we're delighted that she's agreed to take on that role. And then once we've sort of brought people together around those themes, discussions will be how are people represented, what's the work that these groups should take on, who should be formally appointed as chair, what's the decision making within those spaces, and how are we really going to work together. And then that's the idea for how the partnership will operate. So just one last thing to say, we're right at the beginning of that work. We haven't got it all worked out. It's about working with you, with the sector, to shape that together. So please do reach out, come talk to myself. We have an interim coordinator, Caitlin Wallace. We're not massively visible online yet, but we do have a web page through DG Culture, and we'll be looking at how we're developing our communications. And we have an event on the 29th of April, so please put that in your diary. It'll be here in Dumfries at Easterbrook Hall to launch the partnership and bring more people into the discussions around this, how we go forward. Thank you.